Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Josh Sharfstein. Today, we look at a remarkable program in West Baltimore that has reduced infant mortality and improved other health outcomes for more than a decade. I speak to Stacy Stevens, the social worker who directs this effort for the University of Maryland School of Social Work. Joining her is Giselle Joseph, a community health worker and certified lactation consultant in the program. The secret to their success? It's not an app. It's not a quick fix. It's years of grassroots organizing and outreach. Check out our show notes for how to learn more and even contribute. Let's listen. Stacy Stevens, thank you so much for joining us on Public Health on Call. I want to start with a little bit of background. What is Be More for Healthy Babies?
Thanks for having us on today, Josh. Be More for Healthy Babies is first and foremost a citywide initiative located in Baltimore City, out of the Baltimore City Health Department, and also Healthcare Access Maryland and the Family League of Baltimore, that has been doing a collective impact model to ensure that every baby born in Baltimore is able to be born healthy and of a great weight and able to live in thriving families and communities. And it was started in 2009 to ensure that we were addressing at that point concerns about the increase of the infant mortality rate. And we know that, and your listening audience may know as well, that the infant mortality rate serves as a metric of how healthy a family and a community are. And so this work started then, and it has grown tremendously over the last 13, 14 years to now encompass probably about 150 partners who are doing this work across the city to ensure that our youngest residents have a fantastic start and that their families are doing well within the communities that they're living in.
That is a great answer. I used to work for Baltimore City government at the health department when this program started in 2009, and it has just been amazing to watch it grow since then. And one of the ways that it's grown is that it has worked with local efforts, even hyper-local efforts, very local efforts across the city. So you have been involved in West Baltimore with one of these effort called Promise Heights. Could you talk about the infant mortality work and the Be More for Healthy Babies work that you have been leading?
Yes, I can. So the great thing, as this work started citywide, over the last 13 years, we have received funding from Care First Blue Cross Blue Shield to do this work. Initially in 2009, the focus was not only to do it citywide, but also to focus on a couple of communities had the greatest outstanding number around infant mortality rate. And so two of those communities were the communities in West Baltimore, Upton and Druid Heights, in which I've had the honor of directing that work since its very beginning. And that work is out of the University of Maryland School of Social Work in partnership with the School of Medicine. And it's a place-based initiative, meaning the work is an academic partnership, but we are partnering with the work that's being done in Promise Heights within the communities of Upton and Druid Heights. And Promise Heights was an initiative that was created and founded by Bronwyn Maiden in 2009. She loved her community of West Baltimore, and she was concerned about what she was seeing, first and foremost, educational outcomes. And so she visited the Harlem Children's Zone in New York and saw various components of their program and decided to take that and really make it a part of West Baltimore by creating Promise Heights. And so Promise Heights has been an initiative located right in the community. Really, it's a cradle to career program that's really trying to improve the outcomes, not only educational outcomes, but also health, social, and financial outcomes of the residents who live there. And so that initiative continues today.
So you stepped in to essentially bridge a citywide initiative focusing on infant health, initially at least, and this very focused West Baltimore effort, as you said, cradle to career. When you got this program started, and we'll talk about its incredible success in a minute, but when you got this program started, what was your philosophy? What were you trying to do to address, significant challenges with infant mortality?
It was really about getting to understand the communities in which we worked. And so being place-based literally meant that our offices were housed in elementary schools. And so we had access to the families that we are wishing to serve and to walk along with as they were improving their health outcomes. We're able to see the housing conditions. We're able to see the school conditions. We're able to see the conditions of the neighborhoods. We're able to experience and understand bird's eye view of many of the challenges our families face in accessing services, transportation, going to the pediatrician, going to obstetric and receiving obstetric care, receiving nutritious and adequate food in their own community. We drew basically these circles. We drew circles around families, built relationships with them, build deep relationships and partnerships with the schools, so with teachers, with principals. Draw another circle. We built deep relationships with the grocery store owners, the store owners who were in the neighborhood, who were serving residents. Draw circles, we built deep relationships with churches, with housing complexes, with existing home visiting programs, with barbershops. And so the mandate was that it wasn't just the responsibility of an expectant family to really move the needle around improving their health. We were all charged and informed, getting important information about what role we played in supporting that family's success of having a healthy baby.
So it really started with listening and seeing and understanding.
Absolutely. And that still is true today. We are really fortunate to have outstanding staff who work as a part of, who do this work, who lead this work, community health workers, certified community health workers. We have social workers who are on the ground, who are leading this work.
I want to make this a little bit more concrete. And you have invited Giselle Joseph to join us. Welcome to the podcast.
Thank you for having me, Josh.
So it is a pleasure to have you. Why don't you explain a little bit about your role within the Be More for Healthy Babies project in Promise Heights?
Welcome, everyone. So as a community health worker, my role is to provide that health knowledge and self-efficacy, along with outreach services and social support. So what that looks like is supporting pregnant and parenting moms, anyone that has babies 0 through 5, grandparents, fathers, anyone that could join our groups. So we provide this group-based services for families so they can get that educational piece and knowledge during that prenatal part before they have babies, so they can have a healthy baby in the community, right? Helping families navigate systems. As a community health worker, we know that a lot of people don't have access to care, so we help them with Medicaid, helping them with information that they may need, resources like food, So those are some of the things that as a community health worker, I have done so far.
So what's a typical day for you? You wake up, you get to your office and you're rolling up your sleeves and you're going to go out and reduce infant mortality today. What does that look like?
Oh, a typical day, Josh. A typical day for me would be, yes, I get in the office. Clients would call the first thing in the morning, and you never know what call you're going to get, right? I may have a mom that's dealing with breastfeeding issues. And as a certified lactation consultant, for short, that's a CLC, I may have to go make a home visit. She may have latching issues. That's something that is not offered at the hospital, like full on. So some moms need that services. I may get a call one day that they're homeless, and I have to find resources around homelessness. And I work with a lot of teens as well, too. So trying to help them navigate these systems. So that's a typical day for me. Mom is feeling stressed out. Mom needs someone to talk to. I can be on the phone for 2 hours, helping a mom get her emotions together, trying to talk to other family members to support her as well. So my day can look various ways.
Sounds like your clients trust you a great deal.
Yes, they do.
How do you build that trust? How does that happen?
Just being myself, honestly speaking. When I started doing this work and started building relationships in the community, I noticed something about me. I have the ability to just smile. And I never wanted to smile a lot. And then I realized that people would say, like, what's wrong with your face? Fix your face. I'm like, there's nothing wrong with me. But then allow me to smile back. So smiling when your clients are smiling and letting them know it's not okay when they're not okay. Because too often we tell them it's going to be okay. I don't know if it's going to be okay, but we will walk together in this journey, right? And that allowed me to be my authentic self and build that trust with the clients that I have. Because I speak to them the way they speak to me. So I meet them where they are.
That is fantastic. Stacey, as you hear Giselle talking, it's almost like what you designed in 2009 just coming to life.
All right. We are very fortunate to have an amazing team that includes, I will say, Josh, not only the community health workers and social workers, but moms who have been through the program, had a healthy baby, participated in perinatal groups, and then say, hey, how can I help out in my own community? I want to become a parent leader. And so we take time to educate them. They've gone through the classes, and we make sure that we give them some additional skills around, listening and really coaching. And they now lead this work in their own community. They're the ones who are out distributing BHB messaging around safe sleep and around smoking reduction and harm reduction practices and breastfeeding. They're doing that. And they also co-lead their own advocacy group around this work. And so we are super excited about that, really building upon their own skills, getting them ready to be not only employed through this work with Be More for Healthy Babies, but some of them have become employed with some of our partners, supporting home visitors and also in early childhood spaces. So we're excited. And really, the secret sauce is having that time and to listen deeply and respecting folks and recognizing the wisdom that residents and family members have about their own life experience. And that extends not only within the context of their current family, but generationally, and using that as a launching point for discussions around improving health and mental health outcomes and well-being.
Well, it is an incredible story because you have built, and the team has built this over the last more than a decade with some pretty incredible results. I remember there have been multiple years where the birth outcomes in the areas that this program works have been better than the Baltimore average, despite the levels of risk being much, much higher. in these neighborhoods. What are the outcomes that you're looking at? What are the ones that you're most proud of?
So, I mean, overall, I think we were charged with really impacting the infant mortality rate. So decreasing the number of babies that were dying in the community. And a lot of that was around sleep-related deaths and being born early. And so making moves and being able to move that metric, I think when we first started the work, the infant mortality rate was 14 deaths per 1,000 live births. And then I believe in 2019, we were able to reduce that. So we eliminated the disparity between Black infant deaths and white infant deaths in the city to be 3.8 deaths per 1,000 live births. And so what that means to your listening audience is this community is predominantly African American. And so when we're looking at that rate, it looks more comparable to what you might see in like Rhode Island, okay, in some wealthy communities. And so that is pretty phenomenal. And we were able to not only experience that, but our partner across on the east side of Baltimore also experienced similar outcomes of eliminating that disparity and seeing great reductions in that infant mortality rate as well. And we say that is because of not only the level of funding and commitment from CareFirst and many other funders. We can also add to that, Promise Heights received the recipient of a Promise Neighborhoods grant. So that added additional funding into the community, which is really needed for us to address the historical economic challenges that residents have to overcome. But also I want to give a shout out to just like the deep partnership, home visiting, the barber shops, the families who committed to doing this work. They found themselves in this work and they champion this work. And they take it very seriously. So they celebrate this success and they are watching these numbers and making themselves available to support this population that has become so dear to our hearts.
Well, what I hear you saying in part is that these serious health challenges that exist, obviously not just in Baltimore, but in many places around the country, they are not inevitable. They can be fixed. You all have done remarkable work and seen major improvements in the outcomes. But at the same time, the fix isn't a quick fix. It's not an app you download on your phone, despite some people hoping that could, be the solution to everything. It is a real investment, not only in a geographic area, but in the people who live in that area.
Absolutely. We don't do anything by ourselves. We do it in deep respect and in partnership and deep relationship with residents. Residents desire to stay there. They don't want to be uprooted. They have ties, generational ties. They want the best for their children and for their community. So it requires deep, committed, consistent investment from, a financial standpoint, and then I would say from respectful partners. Mm-hmm.
I want to ask Giselle, people might hear about your job and say, that's just got to be a really, really tough job because you are right there with so many challenges that families face, homelessness, drug use, I'm sure, at times, school challenges, rejection by the health system. You're dealing with it all. How do you find strength and optimism and hope in the work that you do?
So first off, Josh, I take a deep breath. I pray about it, but I also target the systems, right? I think about how can I fix some things? And that's through advocating. That's the only way I can get it done, through advocating. Once I can advocate for the moms within the communities, I find strength in that.
And you see success.
Definitely see some success. So when it comes to the teens, we had a teen group that we facilitated in many of the schools that we work. They had challenges around entering school. And we coworker and I, we found the agency where we can get students re-enrolled and went to them. We drove there, didn't have an appointment. Opened, knocked on the office door, got there and said, hey, we have some students that need to be re-enrolled into school. Unfortunately, they were pregnant and had some other, stuff going on. But at the same time, we got it done. They saw us, they signed a paper, and although it was a little challenging trying to get addresses and stuff together, it was done because we showed up. And it was successful. Sometimes making a phone call is not enough. Sometimes sending an email is not enough.
And you see the results right there.
Yes, right there.
Stacey,
yeah, I would say that's the part we missed, Josh, to be honest, is when we saw healthy babies before the pandemic, right? Any baby that was born, we were like, okay, who had a baby? We're going to we want to see this brand new baby. We get to hold the baby. We get to celebrate the birth weight. We get to celebrate the mom, living and doing well and, surviving pregnancy and then, being able to celebrate the baby's first birthday. So we're there to celebrate milestones. This is really important. We are celebrating first birthdays, second birthdays, all of the developmental milestones that our families reach when they get new jobs, when they, obtain new housing and cars and things of that nature. We celebrate as a community, as a family around that. So that is also super exciting. I will say this, that I think this year, when we're looking back over the course of the work that we've done over the last 12 years, we actually can say that our first baby is in the 8th grade. And we're our first group of babies, right? So we want to make sure that there's strong handoffs as we go, from birth to getting folks into kindergarten, to seeing them through elementary school, middle school, high school. That's what we want to hear about.
Be listening to this
success.
and thinking, how can I get this kind of project in my community to make a difference where we've had high infant mortality rates, inequity, and we want to see change too. I want to just ask you to conclude here, each of you, to say one way that people can get started. Giselle, I'll ask you first. What would you recommend for someone calling from another place saying, how can we do what you're doing?
Definitely talk to the community to get started. Find out what's happening in the community, what's working in the community before you implement anything into the community, because you want to know if it's working and how where to begin.
And Stacey?
I agree with that. And I would also say just to see what home visiting programs exist in your community and what the health department may be doing in your community to really improve overall family health outcomes and how you can get involved in that work.
Well, to both of you, thank you so much for telling the story of the Be More for Healthy Babies program in Promise Heights on Public Health on Call.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.